So thanks for joining us today for the Healthlinks webinar series. We are a signature program for the Center for Health, Work, and Environment here at the Colorado School of Public Health, and we collaborate with employers to build a culture of health and safety in the workplace. For those of you who are not familiar with me, I'm Kaylee Rivera. I am the Community Engagement and Trainings Manager for Healthlinks, and one of the best parts of my job is being able to help with this webinar series and provide some awesome educational material to all of the businesses in our network. All our webinars are designed to relate back to our Healthlink standard and the 6 benchmarks that comprise of the Healthlink standard to help provide you and your teams with resources that can help you achieve the workplace health and safety goals that you have. So today we're going to be talking about organizational culture, and many of us are familiar that culture can have a positive or a negative impact on organizations, and it's an important thing to understand where your company lies. Our team frequently receives requests from the network on how to best capture culture, and through our Small Safe Well study, we have been able to take a deeper look into organizational culture and how employees are perceiving the workplace culture within their organization. So we're super excited to share some of these preliminary findings and discuss with all the rest of you on how you can assess your workplace culture. So before I introduce Natalie, I am going to just quickly review the Healthlinks benchmarks. I just briefly mentioned them. This is our Healthlink standard, and we have 6 benchmarks that comprise the standard, ranging from organizational support all the way to evaluation. And today we are going to be focusing on workplace assessments and evaluation. So when you're looking at your organizational culture, you're really going to be assessing it and then later using it as a tool for evaluation of what you're doing at your workplace. So a few general housekeeping items. I do want to let you know that all participants will be kept on mute throughout the duration of the presentation. But if you do have a question, you can just use the chat box feature, and I'll go ahead and read through those questions and supply that to Natalie and kind of monitor that along the way. We are recording this webinar, and we'll be sharing the link along with a copy of the slides in our follow-up email. It also includes the survey, and we really value your feedback. So any feedback you can provide and any recommendations on future topics is very much appreciated. So this is the lovely Dr. Natalie Schwatka. I have the privilege of working with her here in the Center for Health, Work, and Environment, and she's also an assistant professor here at the Colorado School of Public Health in our Department of Environmental and Occupational Health. She teaches an occupational safety and ergonomics course for the Masters of Public Health students and occupational medicine residents. She is a researcher here at our center and has led multiple projects related to worker health, safety, and leadership. She currently works on projects related to small business, total worker health practices, organizational leadership and climate, and workers' compensation. Natalie is passionate about working with community partners on applied research projects that result in improved academic and practical knowledge. I am very happy to introduce her, and I think you're going to learn a lot. I'll let you take it over. Thanks, Kaylee. I'm going to go ahead and switch screens here really quickly before I get started. Can you see the right slide, Kaylee? It looks, I got you, opposite. How about that? That's great. Excellent. All right, Kaylee. So I will go ahead and get started. Like Kaylee mentioned, my name is Natalie Schwatka. A lot of my research experience and my work with businesses over the years has been around assessing culture, how to improve culture, measuring it, how to develop interventions to improve culture. And so I'm really happy to be here today to talk with you a little bit about not only what it is, but how we study it in organizations, how we assess it, and things like that. So today, I will be going over these three things. So how do you measure your health and safety culture, and why do you measure, well, first, why do you measure it, and then how do you measure it? And to give you a sense for how we use it at the Center for Health, Work, and Environment, I will share some preliminary data we have from businesses who are in our small, safe, well study. So just a little bit of background, Healthlinks is a signature program of the Center for Health, Work, and Environment, which I am a researcher within. The Center for Health, Work, and Environment is at the School of Public Health. We're in Aurora on the Anschutz Medical Campus. We are one of 6 national centers of excellence in total worker health and one of 18 national centers for training. And our mission is to advance worker health, safety, and well-being. And one of the ways that we do that is through improving workforce, workplace health and safety culture. So why would you want to measure health and safety culture? I want you all to think for maybe 15 seconds on your own. What do you think your organization's culture is right now, specifically as it relates to health and safety? In your own words, the phrases, what would you see, what would you hear, what would people be doing? If you want, you can type it into the chat for everyone to see. Take maybe 10 more seconds or so. Well, I don't see anything in the chat, so I hope you all thought of at least some ideas of what you might think your culture in your business is like right now. But culture itself, you know, it's a tricky term. We use culture in a variety of ways in society. We tend to think about it in terms of US culture, European culture, things like that. But each business has its own unique culture, and it has a unique health and safety culture specifically. They have their own norms about the way things are done in their organization around health and safety. And so to start us off, I have a definition up here. Culture is all about norms, about how things get done. And they really come about through 2 things. The first thing being what you typically think of when you think of health and safety in the organization. You have policies, you have programs, you have people who are in charge of these safety and health policies and programs, maybe you have some leadership support for it. But the other thing that's important in culture is people's actual attitudes, perceptions, values around these systems, practices, people, and leadership. So both of these items are really important in developing culture. And to help you think about it, I have an iceberg picture here. I'm sure some of you have seen this metaphor a million different times in different contexts, but the iceberg represents things that we can see and things that we can't see in the organization's culture. Above the ice, above the waterline, you can see the systems, the practices, the people, the leadership. These are the benchmarks Kaylee mentioned earlier, but that really only represents 10% of culture in the organization. And what really drives culture is that 90% below the waterline, the beliefs, the perceptions, the attitudes. Do people value health and safety? These 2 things interact to produce norms about how work is done. Is it done safely? Are people healthy while they're working? So let's dive into these 2 levels right here, this 10% first. So this 10% represents systems, practices, people, leadership. Thinking back to the benchmarks that Kaylee just presented, maybe you and your organization have already do workplace assessments. Maybe you have a plan in place to do a needs and interest survey every once in a while. Maybe you have a health policy that everyone gets to accrue sick days or they have health benefits. Maybe you have a safety program where every new hire has to go through a safety training, or PPE is provided if people need protection from work-related hazards. Maybe you have communications that go out about health and safety. Maybe there's a weekly newsletter. So maybe your organization has several of these systems, these practices represented here in the benchmark. But just a quick note about expectations and reality. A lot of businesses that I've worked with, they have a lot of great programs. They have a lot of great policies. They put a lot of effort into developing training programs, creating step challenges, designing benefit packages, but for whatever reason, they're not effective. And the picture that I have here is a safety specific example, but the guy is clearly hanging a safety sign, a sign that, safety matters in the organization, but he's on top of the lift, standing on the rails, clearly not protected from falling off the man lift there. So just because we think that we have the right policies and programs doesn't necessarily mean they're going to be used in practice. And so that's why, going back to this iceberg picture, this 90% below the surface, the beliefs, the perceptions, the attitudes, the values, is important to understand. And because they could be really driving how your total worker health policies and programs are used in practice. So I asked you earlier how you would talk about the culture in your organization around safety and health. The items that I have listed here are just some examples of what, if I asked some employees in some random organizations what they might say. Maybe they would say, my supervisor doesn't really care about safety. Maybe, he makes sure I go to my safety orientation, but once I get on the job, he doesn't really care if I wear my personal protective equipment or not. Maybe there's this general sense that safety doesn't matter because, it's okay to take shortcuts, especially when production's falling behind schedule. Maybe employees are offered sick time, but no one uses it because they're afraid of being the person that, doesn't come to work because they have a cold or whatever. Maybe there's work-life balance questions around, my boss emails me at 10 p.m. at night and expects a response, so I have to respond to all emails at the expense of my sleep. And maybe my organization provides personal protective equipment, but I really feel like they're only doing it because they're worried about how much their workers' comp policy is going to cost next year. So to give you some perspective on how this may play out in practice, I have a couple examples. And this first one here is a safety example. So say there's a manufacturing business and they have a lot of machines in their facility. And per OSHA regulations, all the machines have to be guarded. The moving parts on the machines have to be guarded so that people's hands are protected from getting pinched or nipped, for example. So that sort of policy is in place. However, if you start asking around, you may hear that no one's ever been hurt when the machine wasn't guarded. Maybe you hear management is always pushing production. Maybe you hear safety doesn't really matter. We have some machine guards, but no one ever uses them. And this produces norms about it's okay when it's okay not to guard those machinery parts that are moving. So it's okay not to guard machinery when making a quick machine repair. It's okay not to because no one else ever uses them. It's okay not to when the supervisor isn't paying attention. On the flip side, when thinking about worksite wellness, maybe there's a policy that employees have sick time benefits and they should be taking sick time when they're feeling ill. So that's the policy. But if you ask around, you may hear that it's okay not to use sick time. It's okay to come to work sick. It's not like anyone's ever been rushed to the hospital for coming to work sick. Management is always pushing production, so taking sick time really takes away from your productivity. Maybe employees' health doesn't matter. Maybe there's just that general belief. This sort of situation produces norms about not using sick time when finishing a work deadline is more important than employee health, or maybe no one ever uses sick time. So therefore, it's okay. I should not be using it too. So the key points from this sort of example is to really demonstrate that knowing what you see, hear, or read about an organization around those policies, programs, practices may not be actually what's driving how employees behave healthy or safe in the organization, and really how safety and health is operationalized. So with that, I want to turn to how do you measure health and safety culture? So we know it's important, but how in the world would we go about assessing this? If you're currently a Healthlink's Healthy Business, you've done the business assessment, you've gotten your report card on each of those 6 benchmarks, that gives you a good indication of the sort of high-level policies and programs that you have for health and safety in your business, but it doesn't really tell you about that extra 90% that's driving your organization. So I have a couple key principles up here on when measuring culture in your organization. And the first one here is to not make assumptions.
you may have a good grasp on what people think and say about the health and safety culture in your business, but I wouldn't assume that you know the whole story. So be open-minded about what you hear. When measuring culture, you can use a variety of tools. The one that I will be talking about are perception surveys, but you can also use them in combination of formal and informal interviews with people to get more in-depth perspective on why they're responding the way they are to perception surveys. If you want to get really fancy, you can do focus groups with several people at once. At the end of the day, when measuring culture, everyone should have a say. So by everyone, I mean the owner all the way down to the new hire entry-level employee. Everyone should have a say in defining what the culture is in their business. So perception surveys are a really common way to gauge health and safety culture in an organization. They've been used a lot in the academic literature, and they're commonly thought of as taking a snapshot or temperature of culture. So obviously you cannot 100% understand what your organization's culture is by just doing one employee survey. But what it can do for you is give you a general sense for what's going on. And the idea is that you continue to hand out these surveys and collect data on this over time so you can see trends in perceptions. It is a valid method to gather worker perceptions of companies' value for safety and health policies, procedures, and practices. Like I mentioned, there's a lot of empirical evidence that these surveys are measuring what they're intending to measure. They're reliable. And that they're actually related to a lot of safety and health outcomes like safety practices, engagement, work-related injuries, things like that. They likely include multiple survey questions on Likert scales, which is just having people read a question and respond on a scale of 1 to 5, agree to disagree. And they're often used for benchmarking and evaluation. So like I mentioned, use them multiple time points, sort of plot trends and how your culture is doing over time. So at the Center for Health, Work, and Environment, we choose to measure health and safety culture by looking at 3 big buckets when we ask employees about what they think about their business. And the first big bucket is generally around organizational culture. So we first ask them about their own commitment to their organization. So how committed are they to the business that they work with? And then we ask them about how supported they feel by not only the organization in general, but also their supervisors and their coworkers. We ask them generally about their well-being and their satisfaction with work and life. And then we go into depth about health culture specifically, and we ask them whether or not they feel like their organization supports their health and well-being in general. And we also ask them how engaged they are in health and wellness programming. So what are their motivations for participating in the program, and what are their current behaviors in that program. On the flip side, we look at safety separately, asking similar questions about whether or not they feel like their organization supports their effort to be safe. And then we ask them also to report on their own safety motivations and practices. So when administering culture surveys, just as really any survey that you might hand out in your organization, I would suggest asking the entire company to participate. I already mentioned this, but everyone should have a say, and you should really try to have a high response rate, so it's representative. The survey should be anonymous. The questions aren't so sensitive that you're asking them about their personal health, things like that, but it's still nice to keep it anonymous so they feel comfortable answering the questions. Importantly, I would suggest not having management or supervisors in the room while non-supervisory folks are taking the survey, just so that they can feel like they can respond to the questions a little bit more anonymously. If you want to up your response rate, asking them to complete it during work hours is also really useful. Not only do you ensure a higher response rate, but it also can be a nice way to convey, for the business to convey how much they think this survey is important and what they'll be doing with it. Ideally, you only keep the survey open for a short period of time, since it's capturing the snapshot of perceptions. Keep it only open for a couple weeks. obviously, and now allow enough time for completion. And then here in our survey, we have it in both English and Spanish so that folks can complete it in their native language. So what can you learn from these surveys? There are several things that you can do with the data. If you're a data geek like I am, you'll do a lot of different things with it, but I have a few examples that I'll walk you through with things that you can do with this data. So the basic thing you can do is look at average question responses to each of the questions in the survey to see, in general, where employees are rating their responses to each of the questions. You could get fancier and more advanced and look at group differences. So a lot of times when I've done these surveys, there are differences in responses between management level folks and workers. But in your case, you may find differences between units or departments or between on-site and off-site workers. If you want to get extra fancy, you could then compare all of these different questions to each other between groups. And the idea is to eventually compare these responses year over year to continue to benchmark your progress and evaluate any sort of new policies or programs that you have in place. So to give you an example, I have some fake data that I'm going to show you here. This question, my organization is committed to employee health and well-being, is just one question in our survey, but in our hypothetical example, employees on average rated it a 4 out of 5, which is pretty good. 5 is the highest. So in general, overall, employees do think that their organization is committed to their health and well-being. If we start to look at group differences between workers and management, let's say that we see in the organization that management, here in red, rates it at a 4.5, and their workers rate it at a 3.5. This is a pretty significant difference. What it's showing is workers don't actually think their organization is committed to their health and well-being as much as management does. If we layer in another question here about safety, my organization is committed to employee safety, we again see some differences between workers and managers. But what we also see is that while employees think that in general, my organization is somewhat committed to my health and well-being, they aren't as much committed to my safety. And then if we get super crazy, I won't get too much into this, but it just shows you that year over year, you can continue to compare these responses. And in the case of this fake business, say that from year 1 to year 2 of their survey, they learned that they had a real need to address safety concerns in their business. And so from year 1 to year 2, they had some new safety policies. Maybe they provided more training or more PPE. Again, we see a jump here. Employees are reporting better perceptions of their organization's commitment to their safety. So that's just a couple of ways that you can use the data from these culture surveys. And depending on the needs of your business, you may slice and dice it a different way. So what have we learned from these data? And I see that one attendee did ask a question about providing them with an example perception survey to give to their employees.
I was just going to comment, Alexis, I believe if you're still with Ariel Clinical Services, you guys are actually in our Small Safe Well studies. So that's excellent that you're wanting the survey because you'll be getting the survey. So more to come on that, and we can always touch base offline and kind of discuss where that lives. If you've since left that organization, let's also touch base so that we can find out where you're at now.
Yeah, and so what Kaylee is referring to is we have a small business study that is funded by the National Institute for Occupational Safety and Health, which gets its funding from the CDC, to understand how to help small organizations build their culture of safety and health. We affectionately call it our SWELL study. And in this study, we are including in a health and safety culture assessment survey as part of one of our assessment tools that we help businesses with. And in this study, businesses join Healthlinks, as you all know about it, which includes the Healthlinks Business Assessment, which assesses the 6 benchmarks Kaylee described. Healthlinks offers advising sessions, personalized based on the assessment results. But what's cool about our SWELL study is that we also offer this cultural survey as part of participation, as well as leadership program to help really drive culture change in the business. So businesses that are in our study are able to go through each of these steps. And to help illustrate the culture survey and the results and what we're learning from it, I'm going to focus just on this piece right here for the next few slides. And I showed you this slide earlier with all of the different kinds of things that we include in our culture survey, but I'm going to hone in on these two items here: worker perceptions of their support for their health and worker perceptions of their support for safety, and compare those results. And our question when looking at these data preliminarily was that, do employees from smaller and larger businesses differ on their perceptions of their support for health and safety? So at the Center for Health, Work, and Environment, we are very much focused on helping smaller organizations specifically develop their health, safety, and well-being. And we had a question of, do these culture surveys, what employees report in these culture surveys differ on business size? And specifically in two areas. So culture consensus, this is, agreement. So in theory, in a business, employees should have a general shared understanding of what their culture is. But that may differ based on business size. At the same time, how good is their culture? So not only do they agree on what's going on in their organization around culture, but how good is their culture? So what's the quality of the culture? So when we pulled the data back in April, we had over 1,000 employee responses to the survey from 38 businesses with a median response rate of 30%, which is actually pretty good when you're doing surveys. So if you're doing surveys in your business and you're getting about 30%, you're pretty on track and on par with what pretty much everyone else gets. Like I said, we have 38 businesses in this sample. They come from a wide range of sizes, all the way from those micro employers with less than 10 employees, all the way to larger employers with more than 200 employees. They come from different regions here in Colorado, so they're all Colorado businesses. Most of them are in urban areas over here in Denver or Fort Collins, the Springs, but we do have some more rural businesses in our mountain towns and Grand Junction area. A lot of them are in the services industry, but we do have some businesses who are in healthcare and construction and manufacturing and public administration and transportation. The employees that are represented in the data that I'm going to show you, the 1,000 of them, are pretty diverse as well. So the average age is 40, but there's a wide range of them. 2/3 of them are female. A lot of them are white. About half and half are in a management or non-management role. They are mostly full-time employed, but only half are salaried. We do have some shift workers in this sample, and they've been in with their company on average for 5 years. So that gives us confidence that what they're reporting, they're not necessarily brand new employees and they don't really know what's going on. In general, the employees in our sample have been around a while enough to assess, what are their perceptions of their business's culture. So I have a couple graphs here that I'm going to walk you through to show you how the results panned out for safety and for health by business size. So recall this consensus question. So how much do employees agree about what's going on in their culture? It's broken out by business size from small to large. This orangey red color here is safety. So how much do employees agree on what how much their organization is committed to their safety? On the flip side, the green represents health. So how much do they think their organization is committed to generally their health and well-being? Just to orient you to the y-axis here, it's the level of agreement. So, and it ranges from 0 to 1. A 1 indicates that employees 100% agree on what's going on in their organization or culture. A 0 indicates no agreement. What we see is among the pretty small organizations from 11 to 50 size employers, they have the most agreement. So employees in these sizes of organizations report generally pretty good, decent consensus on what's going on. There's a lot of variability in the larger organizations in terms of what they think is going on in their business. When looking at quality, this is interesting as well. So this is, the question of how good is the culture in the business. And this, again, is broken out by business size, by safety, by health. A 5 indicates the best quality. And we see a couple of interesting trends here. The first trend is that smaller organizations, the employees in them actually report better commitment to their general health and well-being compared to larger organizations. But we saw another slight trend, not as dramatic, for the safety climate questions around whether they think their organization is committed to their safety. We saw that larger organizations, employees in them, generally reported slightly better perceptions of that question. So I'm going to summarize this for you in a couple of slides to help it sink in. What this tells us is that not all businesses, small businesses and large businesses, do have some differences. And the level of agreement about what's going on in their business and the quality of the culture does differ based on business size. Employees in smaller businesses, if you have a smaller organization, your employees are likely going to have a more shared or similar notion of what the culture is in your organization compared to larger businesses. In terms of quality, if your business is small, your employees are more likely to report that your organization is more committed to their health and well-being, but not have as great of safety perceptions as larger businesses. So how can we use these results to help small businesses? What this tells us is that, the way that we're measuring culture, which is those 3 buckets, lots of questions, it's important to look at them all separately. They don't necessarily function the same in your business. For example, you may have a really awesome safety program, but you're currently working on your worksite wellness program, and you would expect your safety culture to be a little bit better at this point than your worksite wellness culture. So it's important to look at them separately. When trying to undertake organizational change in smaller businesses, the fact that we see a shared understanding of what culture is in smaller businesses tells us that it's probably easier to communicate about health and safety in smaller businesses than larger businesses. And in terms of quality, what's nice to see is that smaller organizations have employees that report better perceptions about their business's commitment to their health. But what we see from our standpoint is that we need to provide some additional assistance with building safety supports in smaller businesses. So stepping back to our Small Safe Well study, which we're currently enrolling small businesses in who have less than 500 employees here in Colorado. As part of the study, I mentioned earlier that we're conducting a leadership program. And all of the data that I talked about from these surveys, we're using that data to help leadership teams and organizations, one senior leader in the organization, and someone who also manages the health and safety programs. We're helping them integrate data from their business assessment or their benchmarks and the employee culture survey to make decisions about where they need to go next in their organization to improve their health and safety culture. And again, we're addressing this big iceberg by collecting data on the systems, practices, people, and leadership through the Healthlinks assessment, and information on employees' perceptions about them through the health and safety culture to really get a good snapshot about current norms and to help businesses make decisions about what to do next. And I won't unpack this now. I'll save it for if you're coming to the Healthlinks event. I'm doing a leadership lab to our event where I'm going to be talking about leveraging total worker health leadership to improve health and safety culture. But the way we help businesses think about improving their culture is to, like I mentioned, integrate their culture assessment with their benchmark assessment, help them understand where they fall in each of these areas, whether they're doing really well on both and they're being very successful, or maybe they have a lot of policies and programs, but they don't have the cultures to support it, and helping them strategize ways to make it up to the success box right here. So if you are on the call and you are a small business in Colorado with less than 500 employees, and you are interested in administering that health and safety culture survey to your employees, I invite you to join our small safe goal study. It's free to join in terms of cost, and you get to be able to benchmark the health of your business through the Healthy Workplace Report Card and Health and Safety Culture Report. We provide advising and training in the leadership program, as well as in Healthlink's advising. Businesses are certified, and we do, especially through the leadership program, connect you with other like-minded business leaders who are also working towards building a culture of health and safety in their business. Erin Short is the lady to contact if you're interested in participating. I have her contact information up here. You'll get this slide in a thank you email from Kaylee, I believe, after the call, so you'll have her contact information. I will mention that if you are too big to join the SWAL study, you have more than 500 employees, but you're still interested in administering this health and safety culture survey and interested in receiving the report results on it and interested in receiving advising on your assessment results, Healthlinks will be offering the survey to Healthlinks businesses coming in mid-August. So stay tuned on details for that. Other than that, I'm happy to answer any questions if you have them, and I thank you so much for your time.
Trying to take it back. If anyone has any questions, feel free to unmute yourself, or you can write it in the chat box. I am just trying to switch back over to a couple of different slides, but for some reason it's not wanting to work with me. I was just going to make a few additional announcements. I'll make sure that these are included in the slides that come out with your email follow-up. But I just wanted to remind everyone, we do host these webinars every other week, and our next one is going to be on August 8th, and it's really going to focus on employee engagement and health equity in the workplace. And as Natalie mentioned, if you haven't already signed up to join us at our August 16th event, please do so. We would love to see all of our network there, as well as anybody new and interested or just wanting to learn more about what we do at Healthlinks and how you can connect with other organizations. That is August 16th, and the event is taking place from 12:30 to 4:30. However, we do have a few pre-event workshops. One of them is the one Natalie just touched on with our leadership lab. I think that one's going to be really exciting. And then there's a few others that are going to be hosted, so I encourage you to check out our event website for that. So I'll include the link so you can go sign up and be with us in the morning as well. Additionally, and my screen may have, is my screen showing on your? Oh, yeah. Oh, I was looking at, yeah. Next, as Natalie mentioned, we are having some upcoming changes to Healthlinks, and we're not only going to be talking about it at the August 16th event, but on the 23rd, we'll be hosting a webinar that's just going to go over any exciting updates that we have for you all and how you can get more involved with us. So I just want to encourage you to definitely mark that one on your calendar. It's going to be the same time as always, 12 to 1 p.m. On August 23rd. And any other questions, feel free to go ahead and ask now. We'll wait a couple more minutes, but again, thank you for joining today. And if you aren't recognized and want to be recognized as a healthy workplace, you can definitely join Healthlinks, take our assessment. If you have any questions, you can contact John. His contact information is here as well. And lastly, I will just note that we are starting an ambassador program. So all of you who are very like-minded and really passionate about health and safety in the workplace, if you want to continue to spread that word, if you want to support other businesses, I would encourage you to check out what it means to be a Healthlinks ambassador and get involved with us. I am spearheading that program, and I would love to work with each and every one of you in a more personal way and be able to help reach bigger regions of the area. So feel free to contact myself as well. Have a great afternoon, everyone.